Hello everyone, welcome to my channel. In today's video, we are going to discuss about anemia. One thing we need to note here is that anemia is not a disease, but it's a manifestation of an underlying disease or condition. So for the topics of this title, of this condition, we are going to look at what is really anemia. We're going to look at the people at risk of anemia. We're going to look at the causes of anemia, the diagnosis, how to diagnose anemia. We're going to look at the management, the treatment, and the prevention of anemia. Stay focused and keep on watching. For the mechanism of anemia, red blood cells have a lifespan of 120 days, and the bone marrow is responsible for replacing them more often. Hematopoietic stem cells are the ones dividing, reaching the immature red blood cells called erythrocytes. When they release them in the peripheral circulation, they develop and mature into red blood cells. And adequate red blood cell production requires some food or nutritional substances like iron, vitamin B12, and folate. So to maintain a normal amount of hemoglobin concentration, the amount of blood lost should be equal to the amount of blood produced. Anemia came from the Greek word anemia, meaning without blood. Red blood cells plays a vital physiological function in carrying oxygen to our tissues. Hemoglobin present in red blood cell is a special protein that has the capacity to bind to oxygen in the lungs and deliver them in the tissue. A low concentration of red blood cells in blood or hemoglobin concentration in red blood cell can lead to a decrease in the amount of oxygen in our tissues, leading to tissue hypoxia. Tissue hypoxia is a condition where the tissues are starving for oxygen. Anemia here is defined as a decrease in red blood cell, hemoglobin, hematocrit below the reference range of a normal healthy individual. People at risk of suffering from anemia are women. Women suffer from iron deficiency anemia, mostly during two conditions. We have their period, that is a loss of blood every month. Another condition is during pregnancy. Pregnant women are suffering from anemia due to the need of iron during pregnancy. Another set of people suffering from anemia or at risk of anemia are the older people. This is because they have higher risk of having kidney disease and some chronic conditions. And we know that the kidney has a function of supplying the hormone erythropoietin, which help to produce or stimulate the bone marrows to produce more red blood cells in case in need. Another set of people at risk of suffering from anemia, we have children, that is from 1 to 2 years. This is because children need iron during their growth process. Symptoms of anemia, we have tissue hypoxia. We have already mentioned that tissue hypoxia is a condition where the tissues are starving from oxygen. We also have increase in heartbeat, and we have dizziness, headache, weakness, hands and legs that becomes very cold. We have many causes of anemia, but the three major causes of anemia we have blood loss, decrease or faulty red blood cell production, and we have high degree of red blood cell destruction. Let's look at the first one, that is blood loss. We can lose blood either slowly or massively. Slow blood loss occurs in conditions such as hemorrhoid, gastritis, we have cancer, we can have conditions like NSAIDs that causes gastritis, and we also have conditions like post-surgery. This can make us lose blood slowly without us noticing, but can lead to anemia. And we have massive blood loss like accident conditions. For the second point, we have decrease or faulty red blood cell production. Here, your body might not be producing enough red blood cell to meet up with your body needs, or your body might be producing faulty red blood cells that are not functioning the way they are supposed to function. This is because there must be something wrong with your red blood cells, and this might be lack of minerals or vitamins. The third condition, we have massive or high destruction of red blood cells. This can occur if your red blood cells are very weak and are unable to undergo the stressful conditions of moving throughout your body, and they might burst out in condition or on their way, leading to a condition known as hemolytic anemia. Let us understand the diagnosis that shows if a person is anemic. Firstly, we have full blood count. This involves counting the amount of red blood cells, white blood cells, platelet, hematocrit, and hemoglobin concentration to compare them with the normal reference value of a healthy individual. And secondly, we have reticulocyte count. Reticulocytes are immature red blood cells that are released in the peripheral circulation, which then mature to red blood cells. And then thirdly, we have bone marrow examination. Remember, our blood cells are produced by the bone marrow. And examining to understand if the bone marrow is functioning normally, producing the normal amount to meet up with the blood loss or the amount of blood cells being lost, is very important. Let us have a clear view on the types of anemia. Firstly, we have hemolytic anemia, aplastic anemia, iron deficiency anemia, sickle cell anemia, and lastly, pernicious anemia. Let's look at them one by one. So, for aplastic anemia, it occurs when your red bone marrow is damaged and it cannot produce the adequate amount of red blood cells needed by your body. For hemolytic anemia, we have already mentioned that the red blood cells produced are so weak that they cannot undergo the stress of moving around our body and can burst on their way, leading to hemolytic anemia. Thirdly, we have sickle cell anemia. Sickle cell anemia is a genetic form of anemia that occurs or leads to a deformed shape of red blood cells and hemoglobin that doesn't function normally. That type of anemia, we have iron deficiency anemia. This is mostly common to women and children. This occurs when you consume food low in iron or the body absorbs or poorly absorbs the iron. This leads to low level of iron in the system. Lastly, we have pernicious anemia. This occurs due to the lack of some intrinsic factors, which leads to the absorption of vitamin B12 and also the lack of vitamin B9 and folate, associated with vitamin C, which help to the absorption of these vitamins. Let's look at how to manage anemia. We manage anemia by consuming a healthy diet, by drinking water more often to keep the body hydrated, avoid too much chemicals, exposure to chemicals. Also, keep on regular exercise, that is, exercise regularly. And lastly, wash your hands more often. Let's look at the methods of treatment of anemia. Anemia generally is treated depending on the cause or the type of anemia. For aplastic anemia, you might be given some medications and you can undergo blood transfusion or bone marrow transplant. For hemolytic anemia, you can be given some medications to boost out your immune system. For blood loss, you can undergo surgery to determine the cause of the blood loss and solve the problem. For sickle cell anemia, generally some painkillers are given because it's really painful and some folic acid supplements are added. And lastly, we have for iron deficient, B complex, folate, B12 deficiency anemia, they can be given some supplements to increase the level of those minerals or vitamins. Let us look at how to avoid anemia, how to prevent anemia. This is a very important point. Some type of anemia like sickle cell anemia, which is genetic, cannot really be avoided, but other type of anemia like iron deficiency anemia, folate, can be avoided by consuming food rich in B complex, B9, folate, iron, and together with vitamin C to ease absorption of these minerals and vitamins. Thank you for watching. Hope you appreciated this video. If you learned something, please like this video, share and subscribe. It doesn't cost you anything, but it means a lot for me. If you have a question, please drop it down on the question box and I'll watch it later. Thank you for watching this video. Bye-bye.